Hi, my name is Sean Ennist, and I run the operating rooms here at Premier Bone and Joint Centers.
My name is Dr. Dave Krecka. I'm one of the anesthesiologists at Premier Bone and Joint Centers.
Together, Dr. Krecka and I will spend the next few minutes going over your anesthetic experience here at Premier Bone and Joint Centers.
At Premier Bone and Joint Centers, you will be receiving your anesthetic from one of our board-certified anesthesiologists.
Anesthesiologists are medical doctors specializing in the delivery of anesthesia. For your procedure today, for your anesthetic, you will be receiving monitored anesthesia care, and it includes deep or light sedation, depending on what you might need. Prior to going back for your surgery, your anesthesiologist will be reviewing your medical history.
They'll probably want to know if you have any problems with your heart or your lungs.
They'll also be asking you about your airway. More specifically, if you have anything loose in your mouth, such as loose teeth, dentures, or retainers.
They'll also want to know if you have any limitations to your neck range of motion. This information is important so your anesthesiologist can assure that you can breathe safely during your surgical procedure. This conversation will be done prior to going back to the operating room. We'll have you lay down on the operating room table, at which time we'll put the routine anesthesia monitors on. We'll put a blood pressure cuff on one of your arms, unless you're unable to have a blood pressure cuff on your arm, in which case your anesthesiologist will put the blood pressure cuff on one of your legs. The other monitors include a pulse oximeter, which is a little clip that we'll put on one of your fingers to help monitor the oxygen levels in your blood. Lastly, there are 3 EKG pads that will be placed on your chest, one on each shoulder and one on the left side.
When we get you to the OR, all the monitors and blood pressure cuffs, EKG pads, pulse oximeter, everything will seem cold, but we will eventually get you warm.
We'll also be giving you some oxygen to breathe, either with a nasal cannula that fits in your nose or with a mask. When your surgery is complete, we'll then take you to the recovery room in a recliner. At that time, we'll give you something to eat and drink. We'll let the person giving you a ride join you as well, and shortly thereafter, we'll let you go home.
I hope that this information has been helpful for you. Please don't hesitate to contact us if you have any further questions, and thank you for choosing Premier Bone and Joint Centers.